We're here with Joan Dykman. She's going to share her life story, basically, and how we got to where we are, the Zilka Neurogenetic Institute of USC. This is where all the brain research happens, and it's a special place for the Center for Personalized Brain Health, because this is where we learn what happens. And we're with a special guest today, because she's been getting treatment from the Center for Personalized Brain Health for how long now?
Couple of months. I'm not a special guest. I'm just a guest like every one of you. As I came here with a curiosity about a change in my cognitive health that was the kind of a change that most people would say, oh, that happens to me all the time. Something, I actually looked it up and found out it's called tip of the tongue, where you say, what was the name of that movie? Or what was the name of that street? And then it comes back. But there were decades of my life where that never happened, where I had it. And this wonderful brain functioned beautifully. And it was so much fun. And I wanted that. I want to keep that good brain. And I wanted to find out, did that mean something? The more distressing change that happened much less frequently, but did happen, was sometimes in a conversation, I would, if you imagine a slideshow, that suddenly, yes, exactly, as you're talking about something, images or thoughts, suddenly I got a white slide, a blank, and I had to quickly put together, what was I saying, what was I thinking? It was terrifying. And while that didn't happen as often, it happened, and I didn't like it. So last year, there were big changes in my family. Some members had some health challenges.
Right. We had some injuries, right, like you talked about.
I had a repair of my knee. I had a total knee replacement,
Thankfully,
it was great, because with this wonderful new knee, now I'm able to move more. And so I started doing some indoor cycling. I got myself my little peddler, and I do my hour to hour and a half a day with arms in the first half hour. And I love doing it, and limiting my impact workout is good for me.
From the injury from your knee, it must have been hard to get back into the groove of activity, exercise. Like, it must have been hard.
It was. And it was responsible because it was long term, because I was waiting to do the knee surgery, because you can't do but more than 2 in your lifetime.
Right.
And I didn't want to be stuck going into my 70s or 80s after 2 surgeries that would only last 9 or 12 years each. Now I'm crippled and older and really need to move the body and keep myself healthy, and I can't.
It's key.
Yeah. So I was putting this off as long as possible, and what that did was put me into a mush state of my body not being in shape and having too much weight on, and all of the risk factors that aren't good for you.
It keeps compounding, right? When you're not active, you just can't feel that good, right?
That's right.
You got to start.
You feel a little slower. And waking up those muscles is hard, but fabulous. So great. When you start to wake up that muscle and it knows what it's for again, it's great. So I'm really happy that I'm doing the movement. And I had started that just after my knee surgery, late February last year, and had done some pre-surgery workouts so that I would have the surgery and come out running. Not running, literally.
Yeah. Not literally. You were doing wheelies. You told me on
yes.
On the wheelchair.
Yes, I learned how to do a good wheelie. But last year, having a family member who was so slim and fit and healthy need bypass surgery, which didn't make sense to me.
It sometimes doesn't make sense, right?
Yeah.
And what do you do when a family member like that has all of a sudden needs a heart surgery like that? It seems so big.
Yes.
What did you do?
Well, I investigated. I have a son who was a former stuntman who had a very traumatic crush and traumatic brain injury um, event a couple decades ago. So I've learned to really be a researcher. My mom taught us to be a researcher when we were kids. So I approached his injury the same way with research. And then knowing about the heart situation, I thought, okay, this doesn't make sense. I've got to research this. And while I'm doing that, I also want to check out what's going on with my brain, with the tip of the tongue, or those blanks. So concurrently, I started looking at both things, and I found out that there's a cholesterol they don't test for because there's been no medication for it.
Right. What's the name of this cholesterol?
It's called LP little a, and it's only genetic.
Right.
So it has no relationship to your eating and no relationship to your lifestyle.
Mm-hmm.
It is as genetic as your eye color.
Wow.
So I was born with it.
And you just found out because you were curious, right? You went online, found out how to get tested.
How does this slim, fit, wonderful person need a bypass?
Right.
What's going on? And he wasn't on a statin. And what can make this make sense? So finding out there was something genetic, that was a clue.
Right.
And I found a place to test for that. And I had my test done, and it turns out I'll actually share my number. It's 239, and that's really high.
Right.
So that's a big risk factor. Also, at the same time, I was looking into my brain online, and because I had a history many, many decades ago where USC was so great for my own health when I had a leg injury and they saved my leg. I've watched through the years, and since my son's brain injury, I've gone to them as a source.
Right. To USC, right?
To USC.
It's been your place to go for all these medical specialties.
They take situations seriously that many other places might disregard or say, I don't know that if that has any impact. And they have different departments here, or they have these brilliant minds that are willing to look at and question unusual situations or common ones and see how do these things interact. So
putting all the pieces of that puzzle, right?
So my favorite thing, my brain, that I need to help my family, to live my life, and to find the joy that I've had, because it sees so many things and just cracks me up.
Yeah.
I thought, that's the place. I've got to go there.
It's here.
And USC was running a memory study, and I thought, that's perfect in their Alzheimer's and brain health. And so I signed up for it. I went to the first couple assessments. And then when I had gotten my results back about the very, very high LP little a, and when I went in for the brain scans, I shared about the LP little a. And
brain
rather
scans, the lipoprotein, the genetic factor, the lab results, what happened when you put them all together?
Well, instantly, the eyes, when they heard me say that, I saw, wow, okay, it was significant. So I could see, oh, that's really important. When I left the campus that day after a couple of hours of brain scans, I got a call. And Dr. Elizabeth Joe had referred me over to Keck Beverly Hills to the dementia reduction program.
So
and
straight to dementia reduction just from that. How did that feel?
Terrible.
I imagine. I mean,
because it confirmed for me, all right, so there's dementia. Knowledge is power. And one of the reasons I was seeking out this knowledge in the first place about my brain and the changes in the cognitive function was because not only do I want to keep what I have, I want to minimize what I lose. So The motivation in going was when I realized that I have a responsibility to my family, that I don't want to impact their lives and their goals more than I have to if my life becomes a challenge. So if I do develop Alzheimer's or I develop dementia, and there's such a range of dementia, mild to severe, I want to know. And I want to be prepared so that I can set things up. I can still live a life that is much reduced and find great joy sitting in a garden and smelling freshly baked bread or cookies.
Forever.
Yes,
Yeah.
I could be very happy.
Yeah.
But the limitations that would put on my family,
you have to plan for it.
Exactly.
Right? You have to be proactive.
I wanted to be ready. Proactive is such a word for me. I want to get in there. I want to be preventative. I want to be proactive.
Yeah.
And I want to be real. I want to know what's actually happening. So
that's why you do all this research and kind of even found out for yourself about lipoprotein A.
Yes. Yes.
Yeah.
So when I left USC after the couple-hour brain scans, and I got the call referring me over to Jinseo Choi at Dementia Reduction, the hit was pretty tough for a week and a half. And it's interesting. It reminded me that emotions and our own thoughts about abilities can impact abilities, because I felt less sharp in that week and a half before I got to see her.
Just because you knew.
Just because I knew.
You were scared,
okay.
Like, back of your mind, that was there.
So every day, at any point, if I was not as sharp or on or thinking broadly, I thought, there we go.
You're defaulting to,
absolutely.
Now I'm starting to have dementia. It must be such a scary feeling.
It is.
Yeah.
And it's something you don't feel like sharing because you don't want to scare other people.
You must feel lonely.
It is. And while I know that friends and family would be kind or loving, I also know that until there is more information and I get somewhat of a plan, it's just going to be disruptive, painful information and too scary. And that the knowledge that it was coming, dementia or Alzheimer's, was, and it turns out I don't have the
APOE4.
Yes,
the genetic risk factor.
Right. And again, thank you, Jinseo, for doing such comprehensive tests. And that was part of the USC Brain Health Clinic.
So you were, you kind of felt lonely at this point in your life, right? That week before you saw Jinseo, you kind of you felt this
shame and fear.
Wow.
And I had this terrible secret that I didn't want to
put out, even in your family,
to my sweetheart of 33 years or to my son, because the worry and the change it could mean in their lives.
And so what happened once you got to meet Jinseo, your caregiver here at Center for Personalized Brain Health?
Everybody should have a Jinseo. Everyone should have this experience. I walked into a room with someone I would call a sister, but she is this beautiful, young, smart, observant, deeply kind, listening practitioner. And my life changed.
Wow.
We talked about ourselves. She, of course, encouraged me mostly to talk about myself and my family, and no detail was too small. She wanted to know the journeys. She wanted to know the injuries. She wanted to know the events. And she wanted to know about my family members. She was getting a really comprehensive history.
A deep look, right?
Absolutely.
What's your experiences? Where do you come from?
Yes. And what was my outlook going to be moving into this?
What's your goals? Also super important. What do you want to do?
Absolutely.
Now that we're here?
What am I looking for?
Exactly.
My function for the future. And while I'm jumping forward, she has Jinseo Choi is the hub of my wheel.
Mm-hmm.
She has brought in, because with my LP little a,
Right.
I have this very high vascular risk.
Yes.
So she is bringing in other experts,
right.
who
Cardiologists. You're bringing
fit
in
like a puzzle piece
exactly.
into my life and my plan,
Mm-hmm.
because they are also preventative, they are interventionist, they are open, and it's not as if it's happening at me or to me,
Mm-hmm.
like a lot of medical can feel.
Right.
It's happening with me,
It's-
with my complete involvement,
Right.
with my own opinions, with my own desires or cravings.
It's you're an agent of your care because it's for you in the end.
It is so about me specifically. It's extraordinary. I'd almost feel guilty because it's so about me.
Mhm.
But isn't that how medicine is supposed to be?
Exactly. Personalized medicine. We're all different in the end. We all have different experiences. You experience the injuries, right? That were so tough, not only
Yes.
physically but mentally. But you got to take that into perspective.
Yes.
You got to take the genetic LPA factor into perspective.
Yes.
Although you said you're not APOE4,
Yes.
right? Which is
right.
what they usually
Which is
look
incredible and wonderful.
for. Mm-hmm.
But it turns out that just because you're not
It
an
doesn't mean
Alzheimer's carrier,
Yeah.
it doesn't mean that you're not in line for dementia, especially with a vascular risk and the
Right.
ability to build up plaque that could plug off the food, the blood for the brain.
Yeah.
And I know that, well, my mind went blank because I wanted to talk about.
We can come
Yeah.
back, don't worry.
Thank you.
I like how we went into that. I think we can talk about how it feels like a team and not alone,
Yes.
and then
Oh, that's what I wanted to talk about.
how it's life, then meds, then procedures, and puzzle pieces come together.
What I wanted to really talk about with when they say it's personalized brain health clinic, how personal it really is, because with my son's injury, where he's had 29 surgeries putting his body back together, and a traumatic brain injury,
Right.
and all of the therapies that would involve, or things we come up with just to stimulate.
Mhm.
I've met a lot of different kinds of medical practitioners. We've been in a lot of clinics, we've been a lot of places, and being individually seen
Right.
and being part of it still, and not having it happen
Having
to you like,
Mhm.
oh, this is functionally a rebuild,
Right.
which has almost nothing to do with you or your personality or your
Exactly.
living or how you plan to use it.
This is personal care. It feels like.
This is completely different.
Mhm.
It's not that I am so surprised that it's here at USC, because USC has been extraordinary with their studies. They do nonstop studies from focuses you wouldn't even imagine.
Mhm.
It's just incredible. If you're ever looking at your own issues, just go down their list of studies.
Right. I mean, we're here at the Center for Neurogenetic research. We're here. We're in the room where it happens. If you've seen Hamilton,
Right.
we're
Right.
here, and it feels good to be surrounded by all these bright minds doing research exactly in what you want. Right?
Absolutely, and it's not closed off in any way. It is, you are researching, because as you find out different issues, you're going to every source. I often go internationally
Mhm.
to where there are countries that take things cradle to grave, that have a social medicine system where there's a lot documented, and so the information is very interesting.
Right.
And then different sites across our country. But my research isn't unwelcome. So my questions are taken in
Right.
as part of our whole team approach. Sometimes if you go into an office and you bring up a question,
Mhm.
you're a little bit more
Be like,
shut down.
Shut down. Exactly.
Not here. not
You
here.
bring your own research, and what does Jinseo do with your questions, your research?
She not only will either give her opinion, but she's going to look into it. And this gal calls you after hours.
Right.
She has something occur to her in the evening and she's on the phone to you.
Right.
It's a weekend and she suddenly realizes, wait a minute, you said this. And back that couple years ago, you had this happen.
Mm-hmm.
I think there's a link. So with her, she not only did the very comprehensive family history, my medical history, looking at my medications, going over them, talking with doctors and experts, and making adjustments to those medications to make sure that they were the right ones, that they addressed what could cross blood-brain barrier, mm-hmm. what was best for general health, what looked like it was going to be effective with LP(a), because they still don't have a medication for it yet, what looked like it would bring down inflammation in the body, inflammation in the brain. Mm-hmm. The most amazing, pervasive approach.
Right.
And also room for personality and your life.
Exactly. So what 3 words would you say describe the care that you are given here at Center for Personalized Brain Health?
Proactive, investigative, pervasive. And it's good that you like that one best because I like that one best. Mm-hmm. But in realizing that I needed to cut out certain things, the cholesterol heavy things, or any cholesterol heavy way of cooking something, even though it was genetic cholesterol. Turns out that genetic cholesterol likes to sit on the fat little LDLs and mm-hmm. ride around like a toboggan, right. hitting the walls. And so not only did she come up with a brilliant pharmacy mm-hmm. of medicines to address some of those things right. and approaches. I don't even know how to say it, but the medication change, reviewing everything and making sure that we were on the right ones.
And it's integrating medication, diet.
Absolutely.
Choices in the end, right?
Absolutely. And for me, it's a challenge because while I've taken things out, because once I realized they were bad for me, mm-hmm. it's funny, I didn't want them.
Right.
So
yeah, you don't want what's bad for you.
I actually haven't cooked the sausage in the fridge. I haven't opened those packs of salami. I am passing them on to my beautiful mastiffs. Mm.
But still, you get to enjoy the food that you love.
Yeah. Well, I'm trying to adjust. Mm-hmm. And I haven't found my path yet. But okay. What's nice is this is a journey and it's just started. And I know that the next time I'm with Jinseo, we're going to talk about how do I approach this? Mm-hmm. How do I have a low carb diet that is low cholesterol too? Mm-hmm. How do I approach this?
Right.
Now, granted, a lot of ways you cook things will make a big difference, but
like choosing healthy fats, olive oil.
Yes.
That kind of stuff. And cholesterol might be in butter, right?
Right. Butter, tallow, and heavy cheeses, meats.
Right. So for you specifically, that olive oil recommendation might be.
Right. And what was interesting is that while Jinseo said olive oil, mm-hmm. and I said, gee, I don't really like the flavor of olive oil unless I've peppered some bread and dip it in.
Yeah.
And
mouth-watering even.
Yeah. So she said, what about taking a slug of it?
Oh.
I can do that.
Really?
Oh, it's easy. I got a dispenser top and I just hit it. Mm-hmm. And that is easy. I love the flavor. I just don't want everything I eat to taste like it.
Right. That is so fair.
I like to have things. I'm not even a big person on salad dressing. I like mm-hmm. my salads to taste like the lettuce or the vegetables that they are.
Wow.
So I love Indian curries. That's going to be something that I have leaned on in the past.
They're so good.
And they're so delicious.
Yeah.
and you can make a nice big stew and you have it
A
for
bunch
days.
of veggies, right?
Right, exactly.
You don't need to put a lot of grease or cholesterol.
You don't need any grease because there's always plenty with the garbanzo beans and the spinach and the curries and tomatoes.
So it sounds like you're finding a way through it, and you're getting help with a team, right?
Yes.
You're not alone in this journey.
Yes, absolutely. That's the thing that's so amazing, is that as opposed to walking into something that's just scary and shuts me down, I have so much support that I feel enthusiastic and excited and curious, and I'm encouraged in that. And we know that we're just starting out.
Right.
We know that there will be in the future some treatments for the Lp(a), but I don't have the time to waste.
Right.
I need to do something now because this
do what
is
you can too.
Absolutely. And the way that Jinseo as the hub has brought in other departments,
these specialists, right?
Absolutely. All focused on preventative, all focused on observing smaller details and communicating and working with each other and with me. I'm part of the communication.
I love it.
And as they're investigating different things and they're explaining why they want to look at something and what it could mean, what information it could tell us, then they share the results.
Right. And then you get to know, you get all this knowledge, you get this useful insights, not even knowledge, they're insights.
Absolutely.
Into what you can do. And you get the ultimate choice of like, what do we want to do here?
This is what I'm using. This is what I've got, this body, this fun brain.
Yeah.
And I want to be an old lady with a working body and a fun brain.
That's perfect. And we are back with Joan here. And I also want to talk about your diet and how it changed throughout the years. And especially after you met with Jinseo, with this personalized care treatment that we talked about. How has it integrated in your life? How is diet and exercise a part of your new you?
So the exercise part really changed when I blew out my knee skiing, and that started limiting my movement, and my body became lax.
I can imagine. Yeah.
So for the last year, I have been able to do my pedaling, and that has been amazing. I'm so happy about that.
Every morning, you said, right?
Every morning,
pedaling.
I do an hour and a half.
That's good.
Yeah, I really like it. And I use weights and do arms for the first half hour, 40 minutes. So it feels so good to not only wake up the body, but get it done. And I'm most happy after I've done it.
Right.
Sometimes during it, I don't like it much.
Yeah. It's hard. It's hard. Everyone has this trouble, It's hard to get to the gym. It's hard to do all these things. That's, I think, why it's so important that it's personalized. You do it in your own home.
I found out what really works for me.
Exactly.
I thought also I didn't like to sweat in front of other people or with other people.
Yeah.
I was really private about it. But recently I traveled to St. Louis and I was going to have to sweat with other people. It actually was fine. I was able to be in my own world. It turns out people don't do a lot of interaction while they're also sweating. So I was able to get it done. And that felt so great. Also, I was visiting family. So there was wonderful support in making sure I was able to continue what I was doing that was so good for the body and now necessary, as we've learned. And also they were great about the changes in my diet because when you have a family function, sometimes it's really hard. What are you going to do about the food that you are now eating or can't eat anymore? Even though beautiful Jinseo said you can have 4 treats a week.
And 4 little cheats, right?
Yeah,
for something
treats,
that you love.
A pastry, cookies,
not
meats.
huge either, right?
Well, I don't know. I
A
mean,
meal that you love,
I could.
regardless of.
She knew I love my meat. I
Mhm.
especially love sausage and salami.
Right.
And I had already talked about. I used to do adventures with my mom,
Uh-huh.
who lived to 98, and we
Wow.
used to go out seeking the best cream puff in San Francisco. And we would hit 4 or 5 bakeries and
Yeah.
collect them and go to the seaside, and then we would test them.
Puff testing.
Yes. So I love those things. And that's what I mean. It was personalized. She
Mhm.
wanted to know those stories.
Mhm.
And she remembers them. What a mind.
Right.
And she said, Joan, do that.
Right.
Have those treats.
It's joyful for you.
Yes. Because a lot of my happiest times in life and times with friends and adventurous times are at the table or
Right.
cooking.
Right.
And I love that. So
it's important to still have what you love.
Yes. And in that, I'm still lost. I'm just investigating. I'm just beginning.
Mhm.
I have made changes where I've removed things from the diet.
Mhm. Like cholesterol heavy stuff, for example, because
Yes.
your
I
your
switched
genetic factors
Yes.
that now you know about.
things that I kind of used to brag about before, saying, oh, I don't have to worry about that.
Right.
And I would eat 3 eggs a day at least.
Mhm.
I loved, if I had breakfast or dinner, that was great. I
Right.
loved omelets.
Yeah.
I loved eggs. So going to egg substitutes
Mhm.
it's interesting when you know something is that important.
Right. And diet is perhaps the most important
So
thing
important.
you can do for many factors of your life.
Because you can control it.
To the T.
And it affects how you feel about things. And emotion is really important
Mhm.
in this journey.
Cheers to that.
I know, I love these. Yummy.
Mhm.
And it's good that you like that one best because I like that one best.
Mhm.
But in realizing that I needed to cut out certain things, the cholesterol heavy things, or any cholesterol heavy way of cooking something, even though it was genetic cholesterol, turns
Right.
out that genetic cholesterol likes to sit on the fat little LDLs and
Mhm.
ride around like a toboggan,
Right.
hitting the walls. And so not only did she come up with a brilliant pharmacy
Mhm.
of medicines to address some of those things
Right.
and approaches. I don't even know how to say it, but the medication change, reviewing everything and making sure that we were on the right ones.
And it's integrating medication, diet,
Absolutely.
choices in the end, right?
Absolutely. And for me, it's a challenge because while I've taken things out, because once I realized they were bad for me,
Mhm.
it's funny, I didn't want them.
Right.
So
yeah, you don't want what's bad for you.
I
That makes
actually haven't cooked the sausage in the fridge. I haven't opened those packs of salami. I am passing them on to my beautiful mastiffs.
sense. But still, you get to enjoy the food that you love.
Yeah. Well, I'm trying to adjust,
Mhm.
and I haven't found my path yet. But what's nice is this is a journey and it's just started. And I know that the next time I'm with Jinseo, we're going to talk about how do I approach this?
Mhm.
How do I have a low carb diet that is low cholesterol too?
Mhm.
How do I approach this?
Right.
Now, granted, a lot of ways you cook things will make a big difference, but
Like choosing healthy fats, olive oil,
yes,
that kind of
Yes.
stuff, instead of more. I feel like cholesterol might be in butter, right?
right.
And
Butter
tallow.
and heavy cheeses, meats.
Right.
So
So for you specifically, that olive oil recommendation might be.
right. And what was interesting is that while Jinseo said olive oil,
Mhm.
and I said, gee, I don't really like the flavor of olive oil
Right.
unless I've peppered some bread and dip it in.
Yeah.
And
Mouth watering even.
yeah, so she said, what about taking a slug of it?
Oh,
I can do that.
really?
Oh,
Little
it's
spoonful?
easy. I got a dispenser top and I just hit it.
Mhm.
And that is easy. I love the flavor. I just don't want everything I eat to taste like it.
Right. That is so fair.
I like to have things. I'm not even a big person on salad dressing. I like my salads to taste like the lettuce or the vegetables that they are.
Wow.
So I love Indian curries. That's going to be something that I have leaned on in the past.
They're so good.
And oh, they're so delicious.
Yeah.
And you can make a nice big stew and you have it for days.
Bunch of veggies, right?
Right. Exactly.
You don't need to put a lot of grease or cholesterol.
You don't need any grease because there's always plenty with the garbanzo beans and the spinach and the curries and tomatoes.
So it sounds like you're finding a way through it, and you're getting help with a team, right?
Yes.
You're not alone in this journey.
Yes, absolutely. That's the thing that's so amazing, is that as opposed to walking into something that's just scary and shuts me down, I have so much support that I feel enthusiastic and excited and curious, and I'm encouraged in that. And we know that we're just starting out.
Right.
We know that there will be in the future some treatments for the Lp(a), but I don't have the time to waste.
Right.
I need to do something now because this
do what you can too.
Absolutely. And the way that Jinseo as the hub has brought in other departments,
these specialists, right?
Absolutely. All focused on preventative, all focused on observing smaller details and communicating and working with each other and with me. I'm part of the communication.
I love it.
And as they're investigating different things and they're explaining why they want to look at something and what it could mean, what information it could tell us, then they share the results.
Right. And then you get to know, you get all this knowledge, you get this useful insights, not even knowledge, they're insights.
Absolutely.
Into what you can do. And you get the ultimate choice of like, what do we want to do here?
This is what I'm using. This is what I've got, this body, this fun brain.
Yeah.
And I want to be an old lady with a working body.
Precisely.
And a fun brain.
That's perfect.
Brain.
That's perfect. Wait, that was so good. That's going to be amazing.
Can I say something?
Yeah.
I think when something rough happens to you, it's always nice if you can give it a value. So it's not a negative, so that it has something beneficial you can bring to your life, to people who you care about, to the world. And learning that I have risk, and that certainly what's happening in my journey is so personal to my life history, my family genetic history, the injuries I've had, the medications I'm on, the things I need to be on.
Exactly.
The thing that I really, really hope is that by saying that this started with a curiosity about how come I'm having tip of the tongue? What's going on? And what could that mean for my beautiful family, my wonderful son, my sweetheart? And just asking that question and taking myself seriously and seeking some answer to know if I can do something. I'm so glad I didn't shut myself down. I'm so glad I reached out. And if you have that experience where you want to tell someone the name of a book and it blanks on you, it leaves your mind, or you've noticed little things, be good to yourself. And there is a place where they take you seriously, where I came in with something that so many people said, oh, that happens to me. And it could have been dismissed, and it wasn't. It was investigated. It was seriously investigated, and we're still doing that.
And it's a journey.
It is. And I'm going to be here for it. Isn't that wonderful?
Yeah.
Because that's what I want. I mean, I want to hit 113. That's my goal.
Wow.
So
that's the number.
Yep.
And hit it, not only get there, but it's about how you get there.
Dancing, right? And talking.
There you go.
Yep.
Because you're an artist too, and you've kept doing the things that you love.
I have. I write. I've been an actor. And I'm so lucky that I've had those things, because it's enabled me to live in different countries and to meet wonderful friends. And those friendships are really important to me. We travel together every other year, and just being able to regularly, even though it's every other year, but to be able to touch base and to see each other, to watch out for each other, and just caring and traveling.
Right. And it's so important to keep doing the things that make you love life.
Yes. That make you you.
Exactly.
That keep you especially curious.
Uh-huh.
Curiosity is probably my favorite thing.
And that's honestly one of the things that's been in the research, how still learning throughout your lifetime, keeping curious. They call it kind of like the baby mindset, like this awe that you have at the world. Like, just keep that open, keep having questions, keep being curious.
That's beautifully said. That's exactly right.
Mm-hmm.
And you're right. That is how, I know I said it before, but I'd say it again. Look at the list of studies. Look at the things that someone became curious about, that are going to tell us that are going to tell us something important, or something meaningful that will add benefit to our lives,
to our health, to our society. Yeah. I want to talk about your kind of like the pragmatic questions, like how often do you come? How do you come? Like, do you drive here? Do you take a bus? Is it close? How do you schedule your appointments? Who do you talk with? How does this integrate with your life? Because we've talked about the impact.
Mm-hmm.
It's so important. How do
they
you
are immediately responsive with appointments. I have been...
Just over email, you call?
Well, I call. I like that. I do better with that.
Uh-huh.
With communication, I have set appointments, so I know that that's coming, but there tends to be conversations that we do have both on the phone,
Mm-hmm.
and especially with Jinseo.
Yeah.
Because she's always putting things together.
It's all in her mind.
It is incredible. It's incredible. I hope that you put her on camera, because...
Coming up soon.
Yes. And there's the online, there's the My Chart app, My USC Chart.
There's My Chart app.
And there is such great communication and shared communication with that,
right,
so that everyone can see the different tests. Everyone can
results.
See, yes, exactly.
There's scans, I'm sure.
And they are notified, and here they get the new information. Mm-hmm. And my doctors outside, because I had some wonderful doctors, a rheumatologist. I have wonderful outside doctors, mm-hmm. and they are brought in.
Together.
It's terrific. So it's like arms are put out and brought everybody in. And the information is there. Mm-hmm. Nothing is secret. It's not secret from me. I don't think that because you know this place, mm-hmm. you may not know that many places don't let you see your own scans or the results.
Wow.
Yeah. You only hear what the specific doctor's opinion is of that result. Mm-hmm. And I think that's kind of crummy.
Yeah. Now you get to see all your medication, your results, your conversations. It's all in one place.
And conversations or reach outs between them, so I know also what's happening. Uh-huh. It's really fabulous.
Remarkable.
So I know that there's a great bus system that comes here. I tend to drive myself. Mm-hmm. There's so much parking, which is great. I do that because then I kind of line up, oh, what else can I do in that area? We do a lot of telehealth. So it is great that I work from the phone, but meaning doing the telehealth
Exactly.
wherever I am.
You can just call.
That actually has been wonderful for me because it means wherever I've traveled, I'm still okay.
Good.
So I had conversations while I was in St. Louis or Sacramento, and of course my follow-ups here, as well as the ones in person.
Mm-hmm.
But if I didn't like the phone, I could still do it.
Right.
I could still have conversations on a regular phone. I could still make my appointments on the phone. I love the clerks here handling the appointments. They are so helpful. They are so terrific. And the nurses working with the doctors, very communicative about what's coming up. So communication is the biggest thing here, isn't it?
And it sounds like it's so integrated. It's
well
put together.
Very. And you are part of that.
Thank you. That's so kind. Yeah, I'm trying to put the word out there, for the people who don't know what the possibilities are. And I'm very grateful for you sharing your story and your experience.
Wouldn't it be great if somebody was dismissing what they were feeling about themselves and just one person saw, oh, she was thinking that too, and just looked into it for themselves.
Right. And you have the power now to look into it for yourself.
Right.
Everyone has a phone.
You can just call in. You can just call in. I had a girlfriend that I'd been talking about this to, and she just called in, and she has an appointment coming up.
Wow.
Yes.
I think you must feel proud.
3 or 4 days.
Yeah. Good.
I can't wait.
Yeah.
Yeah.
To put your friends on. Wow. That's honestly the biggest thing you can say. That's the biggest compliment. Like, I want to put my friends on this personalized care because I believe in it so much. Wow.
Changed my life.
Right.
I'm not outside aging anymore.
Mm-hmm.
I'm not outside my own health anymore. I am truly an active participant. And I know that people have said through the years, oh, you're what you eat, oh, you need to exercise, oh, you need to, all these things that you're told you should do. They are true, but it's all a mystery.
Exactly.
And you don't understand the linkage.
Especially how to put it together.
And what has been smart is that not just Jinseo, but the doctors that she has brought in with the same mindset have communicated the meaning or importance of linking up those things, the medications, the movement, the diet, the emotional balance, and feeling good about it all so that you are right there. You feel empowered and excited. And it's not this scary thing like I had for that week and a half.
Right. Yeah. Thankfully, you changed that mindset once you got into the clinic.
It was changed for me. I walked in the door. It was completely different. Completely different.
I'm so glad. So glad. One last question that I do want to ask. What is it that surprised you? Is there anything that you weren't expecting that you want to share?
I didn't expect to matter. Isn't that silly? I didn't expect that I would be seen and heard and valued.
That is so powerful. And with that, thank you so much for this interview, Joan. This has been amazing. I'm very grateful, and our viewers and their families are going to be so grateful for your help in sharing this message.
It's a wonderful place.
Yeah. Thank you.
Sorry.
That was so fun. No, you're just